Hello everyone, my name is Dr. Haukam YP, Assistant Professor in the Department of Political Science, Sri Venkateswar College, University of Delhi. Today I'm going to talk to you about a very important problem that we face during this extraordinary time, that is social stigma associated with COVID-19. So, in the very first place, what do we understand by social stigma? So, social stigma in the context of health is a negative association between a person or a group of people who share certain characteristics and a specific disease. In an outbreak like this may mean people are labeled, stereotyped, discriminated against, treated separately, or experience loss of status because of a perceived link with a disease. Such treatment can negatively affect those with the disease as well as their caregivers, family, friends, and communities. People who don't have the disease but share other characteristics with this group may also suffer from stigma. So, the current COVID-19 outbreak has provoked social stigma and discriminatory behaviors against people of certain ethnic backgrounds as well as anyone perceived to have been in contact with the virus. So, the question is, why is COVID-19 causing so much social stigma? The level of stigma associated with COVID-19 is based on three main factors. Number one, it's a disease that's new and for which there are still many unknowns. Number two, we are often afraid of the unknown. And number three, it is easy to associate that fear with others. Okay. So it is understandable that there is confusion, anxiety, and fear among the public. Unfortunately, these factors are also fueling harmful stereotypes. So then, what is the impact of this social stigma? Stigma can drive people to hide illness to avoid discrimination, and also stigma can prevent people from seeking healthcare immediately. Stigma can discourage people from adopting healthy behaviors. So that is why it is very important to look at how the impact of social stigma. And let us talk something about the way to address social stigma or how to address social stigma. So, how we communicate about COVID-19 is critical in supporting people to take effective action to help combat disease and to avoid fueling fear and stigma. So that is why an environment needs to be created in which the disease and its impact can be discussed and addressed openly, honestly, and effectively. So, words matter. Okay, when talking about coronavirus, certain words, for example, suspect case, isolation, and language, may have a negative meaning for people and feel stigmatizing attitudes. So they can perpetuate existing negative stereotypes or assumptions or strengthen false associations between the disease and other factors, create widespread fear, and dehumanize those who have the disease. So these can drive people from getting screened, tested, and quarantined. So we recommended a people first language that respects and empowers people in all communication channels, including the media. So words used in media are especially important because these will shape the popular language and communication on the new coronavirus. So there are so many do's and don'ts when we talk about coronavirus. Let's talk positively and emphasize the effectiveness of prevention. And also, it is important to do your part, play your part. Governments, citizens, media, key influencers, and communities have an important role to play in preventing and stopping stigma surrounding people from, let's say, various places. Okay, so we all need to be intentional and thoughtful when communicating on social media and other communication platforms, showing supportive behaviors around the new COVID and novel coronavirus or the new coronavirus. So it is important to spread the facts. Stigma can be heightened by insufficient knowledge about how the new coronavirus is transmitted and treated, and how to prevent infections. And also, social media is useful for reaching a large number of people with health informative at relatively low cost. That is why it is very important to spread facts in social media that we use today. It is important also to engage social influencers such as religious leaders on prompting reflection about people who are stigmatized and how to support them, or respected celebrities to amplify messages that reduce stigma. And also, it is important to amplify the voices, stories, and images of local people who have experienced the new COVID-19 and have recovered, or who have supported or loved one through recovery, to emphasize that most people do recover from COVID-19. Also, implementing a hero campaign honoring caretakers and healthcare workers who may be stigmatized. And today, we also have many volunteers. So, community volunteers also play a great role in reducing stigma in communities. And also, it is important to engage ethical journalism. Okay, journalistic reporting, which overly focuses on individual behaviors and patients' responsibility for having and spreading COVID-19, can increase stigma of people who may have the disease. So some media outlets have, for example, focused on speculating on the source of COVID-19, trying to identify the patient zero in each country. And I think this is not the time to blame on each other about the origin or about the spread of COVID-19. I think it is time to prevent and time to think about how do we move ahead during this extraordinary time. Okay. And also, let us talk something about communication tips and messages. Okay. An infodemic of misinformation and rumors is spreading more quickly than the current outbreak of the new COVID-19. So this contributes to negative effects, including stigmatization and discrimination of people from areas affected by the outbreak. So we need collective solidarity and clear, actionable information to support communities and people affected by this new outbreak. So we have to correct misconceptions, rumors, and also misinformations that contributed to stigma and discrimination, okay, which hamper response efforts. And also we need collective solidarity and global cooperation to prevent further transmission and alleviate the concerns of communities. So it is important for us to share sympathetic narratives or stories that humanize the experiences and struggles of individuals and groups affected by COVID-19. And also communicate support and encouragement for those who are on the front line of response to this outbreak. For example, healthcare workers, volunteers, community leaders, government employees, etc. And lastly, facts not fear will stop the spread of novel coronavirus. So it is important for us to share, and it is our responsibility to share facts and accurate information about the disease. And we have to challenge the myths and the stereotypes. We have to choose words carefully. The way we communicate can affect the attitudes of others. Finally, let us not discriminate, let us not stigmatize, but let us cooperate and save humanity. Thank you.